Good afternoon, everyone, and thank you for joining us. This is Paige Hancock, Marketing Manager at Spok, and I'll be moderating today's webinar. Today, we'll be talking about 10 things you should know about BYOD, or Bring Your Own Device. Jason Stanlin, Manager of Mobility Solutions at Spok, will share the results from a recent survey of more than 350 healthcare professionals on BYOD in their organizations, and his experiences working with health systems and hospitals in rolling out mobile solutions. Before we get started, I'd like to go over just a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box, which is in your GoToWebinar toolbar, and then Jason will answer as many questions as time allows after the presentation. We'll also be doing a few polls throughout the presentation where we would love to get your insights. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, and please do feel free to share these with others at your organization. And lastly, at the end of the webinar, you'll have the opportunity to complete a short evaluation. We would love it if you could take a couple of minutes to complete this survey. Your feedback really does help our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Jason, who will begin our presentation.
All right, thank you so much. Thanks everybody for joining the webinar today. Again, the topic is on 10 things you should know about bring your own device in healthcare. So I think this is going to be a great topic for today. Lots of information. So healthcare organizations around the U.S. continue to wrestle with staff and whether they're allowed to use their personal devices for work. I mean, this has been sort of BYOD has been a big topic in healthcare for many years now, and I've worked with a lot of hospitals in my experience that have really struggled with the challenges that come along with BYOD. From, what are we using these devices for, what use cases, what applications, which roles and users should be using their personal devices versus which ones should we deploy the devices to. And then, of course, there's the privacy and security considerations that go along with all of that. So a lot of the things we're going to talk about today are going to tie to those topics. So we really wanted to better understand BYOD policies and BYOD practices in 2017. And to further our understanding about current trends in hospitals, we conducted a survey, and we included about 350 healthcare leaders that responded to the survey. And we're going to talk about the results of that survey in today's webinar. So the first thing that you should know about BYOD in 2017 is that 71% of our respondents said that they do allow some form of BYOD in their hospital. And that is up from 58% in 2016. So, we're going to talk a little later about the business drivers of BYOD and why maybe so many hospitals are allowing it now. I think one of the biggest drivers, obviously, is user demand, which we're going to cover later in this presentation as well. We're going to talk a little bit about how many nurses and physicians prefer to use personally owned devices. We're going to talk about how many of them use their own personal devices even when BYOD isn't allowed. So there's a lot of drivers that are really moving this trend forward. And I think we're seeing BYOD trending upward in really almost all industries, but healthcare is certainly one of those industries where we're seeing a lot more hospitals seeing the value of allowing users to use their own personal devices for financial reasons, for productivity reasons, patient care-related reasons. It's a very, very good thing to consider at your hospital. Now, of course, it does come along with many challenges, which we're also going to discuss in this presentation. The second thing that you should know about BYOD is that data security is the #1 reason that some hospitals do prohibit BYOD. So obviously the use of a personal device is usually preferred by a lot of users. Not all of them. We're going to talk about that a little later. There are many of them that do actually reject the idea of using their personal device. But many users do prefer it. They want to use the kind of device they're comfortable with. And a lot of the consumer devices out there that users are using they have a tremendous amount of value when it comes to the applications and services that are provided on them. But of course, if you're using a personal device and it's unregulated, it could have potentially applications that contain malware. There could be devices out there that are jailbroken. There could be devices out there that are not encrypted or they don't have passcodes on them. And you start using clinical applications on these personal devices, there's the potential, obviously, that PHI could get out. And so the idea, of course, often in healthcare is if we're going to support BYOD, we either need to have a way to manage and secure these devices at the device level using a mobile device management tool or enterprise mobility management tool, where we can enforce specific security policies on the devices. Oftentimes, the difficulty with that is that users do reject that level of security and management. It's very difficult sometimes, and they view MDM as sort of a big brother type of technology. You can also secure things at the network level, of course, but that's limited in that if a staff member, a nurse, or physician leaves the organization, all of those network controls that you have in place when they get on their home network are no longer valid. So it's really challenging to say, all right, we're going to allow you to use your personal device and put all this great data that you need for clinical decision making and for patient care, but now we're talking about a security concern, and we have to control that and regulate it. And when we try to put controls and regulations in place, oftentimes users don't care for that. So that's really where a lot of the challenge here is coming from. The third thing that you should know about BYOD is that 41% of nurses and 63% of physicians use personal devices for work even when BYOD is not allowed. So if you don't have a BYOD policy, if you don't have management controls in place, you're obviously putting potentially the hospital at risk. So if you're just opting out of BYOD and saying we're not going to support it, there is the potential that 63% of your physicians and 41% of your nurses are going to continue to use their own personal device for some form of work-related purpose. You know, they may be accessing patient information. They may be looking up reference information. They may be oftentimes texting and communicating back and forth about patient care on their personal devices, and it's completely unregulated. And they're doing that even when it's not allowed. But why are they doing that? Of course, because perhaps they don't have other communications tools that are enabling them to do their job as productively as possible. So I have a quote here actually from Sally Reeves, who's a healthcare project director at Frisbee Memorial Hospital in Rochester. She said things happen too quickly now in hospitals, and information needs to be distributed at such fast a pace in order to coordinate the next thing that's needed. If you don't provide a communication system, your users will find one, and they're going to use it regardless. So it really comes down to, are you providing the kind of communication solutions that are secure and enterprise, scalable at an enterprise level? Are you providing the kind of tool sets that the users need to ensure that they can be as productive as possible? If you're not, and they're more comfortable with another tool, or they think they can get their job done better with another tool that they have in their own life, they're likely going to use that other tool just to be more productive. So it's about making sure that you're providing the kinds of tools that the users need on any device that they're using, whether it's hospital provided or personal. But once you're providing those tools, right, those tools like Spok Mobile, for example, or Epic Haiku, if you're deploying to devices, they've got to be secured. They've got to be managed, and because they contain PHI. The fourth thing you should know about BYOD is that hospital-issued devices are preferred by 59% of nurses and 38% of physicians. So you can actually see the sort of inverse where we were talking about more of the demand prior to this, and now we're talking about, well, there's actually a good number of nurses as well as frontline staff that just prefer to have hospital-issued devices. And oftentimes we see there's more than half, in fact, of nurses that would rather you provide them with a device than have use their own. I generally see this in my experience with shift workers, right? They go on shift, a nurse or a staff member, they're working, and then they go home. They're not responsible for a specific specialty. They don't go on call. So they want to be able to just use a device, have that work environment while they're at work, and then just leave it there and go home and be detached, right? So oftentimes the staff and nurses that are more shift-based workers much prefer a hospital-issued device. Also, a lot of times I see, particularly in nursing, that some of the nurses much prefer these function-built devices, like, for example, the Spectralant Pivot. They have features for healthcare that these consumer devices don't have, and sometimes those are more beneficial for certain staff members and nurses as well. A lot of times what I see, and I was actually just at a hospital just yesterday or the day before, and I was talking to some nurses, and we were looking to put a secure text messaging application on their personal devices. And we had put out a lot of communication, and the majority of the organization was really accepting of the deployment of the solution on their personally owned devices. And they were this hospital was just rolling out a BYOD policy as well. But these nurses were bringing up some points that they were concerned about. They said, I don't want hospital-issued applications on my personal device because it's invading my privacy. They perceive it that way. They perceive it as, I want to keep work out of my personal life. I want them completely separate. I don't even want them on the same device. There were questions around, well, what's in it for me, right? So if I'm using my own device, what are you giving to me? And then another thing that I found really interesting that was brought up was that one of the nurses said, and I've heard this actually a number of times, but from a lot of different hospitals and roles, and he said, well, patients don't like it. I can't pull out my personal iPhone and respond to a notification in front of a patient, and I'm often in front of patients. How am I gonna do that? And one thing that we had consulted with this particular organization about as well, and we do help with this type of thing in our consulting services practices. Hey, this is a change in culture, and it's a change in culture not just for your internal, hospital staff and nurses and physicians, but it's a change in culture for patients as well, right? What we all need to understand is that these are a lot of these consumer devices, and they are powerhouse clinical tools, right? And it's really important that we leverage the value of these tools to help improve patient care. And so it's what patients and nurses and staff and physicians all need to understand, right? And we have to sort of pivot to in this industry is these are medical tools, right? So, one of the things we were talking about is creating an actual outbound marketing campaign to patients that says, if you see our doctors and nurses using iPhones, they're using it to better your care. And list out some things that they're doing. They're collaborating, sending secure messages back and forth about patients. They're responding to alerts. They are accessing patient information and medical records and clinical decision-making tools and so on and so forth to make patient care better. And the other thing we were talking about is potentially looking at deploying some cases, the variety of different cases depending on the role that actually had like the hospital logo on them, so that when you go to work, you throw your case on and it has the hospital logo on it, and then it sort of changes the perception that this is a tool, a healthcare related tool. It's not a consumer device. Those are some just interesting things to think about. The next thing you should know about BYOD in 2017, number 5, is that the top 3 BYOD challenges. So, if you deploy bring your own device, what are some of the biggest challenges that you're going to face? Of course, you're going to face data security challenges, right? We've kind of already addressed that, right? You're going to have to find a way to manage the device, manage either an application management solution, device management, network management solutions need to be in place to ensure you're protecting any PHI on the devices, and then you're going to have to deal with any potential resistance for putting those security tools in place. So that's obviously going to be a challenge. We're also finding in our practice and in our surveys that And I see this all the time, that both Wi-Fi coverage and infrastructure and cellular infrastructure and coverage are major challenges. And it's not just coverage, it's not just capacity, it's also architecture and configuration. So, when you're deploying clinical applications to whether they're hospital issue or BYOD devices, they could be time-sensitive applications. Like, for example, Spok Mobile, a secure text messaging application. Users essentially have to be connected to a network at all times, ubiquitously, in order to get the clinical information they need in the second that they need it, right? And that puts a tremendous demand on the network, right? So you got to ensure that you got coverage in place, that you've got a good AP architecture set up, you've got your controllers configured to best practices specs. I've seen a ton of different issues in environments, from APs that are limited to 2.6 gigahertz that causes code channel interference, to issues with APs that are set to full power and so devices can't connect to them because the access points are too far away from one another. I mean, there's just a ton of range of things that, number one, could prevent your users from connecting and getting access to the information that they need. And number two, if you're bringing on a bunch of bring your own devices, it's harder to manage. It is harder to manage capacity. How many users are going to be connecting to an access point, and what is the demand of data that those devices are going to be looking to obtain. So I think that's a thing that, even if you don't, whether you support BYOD or not, this is going to be something that you need to address. And every single hospital I've gone to, because secure messaging does have and I work with secure messaging deployments a lot, it does put a tremendous demand on the network in terms of the device needing to stay ubiquitously connected to the internet. Every single environment I've gone in has had some issues with their wireless network. We've done assessments with some of our partners in some customer environments, and we found all sorts of issues that needed to be mitigated before we could adequately support these applications on any device, really, but particularly on bring your own device with personally owned devices. And another thing with this, right, is which networks are you going to allow your personally owned devices to be connecting to? Because I've seen a lot of cases where customers will have a corporate network that actually is really spec to best practice, but they've got a more skinned down guest network or even a BYOD network that just simply doesn't have, it's not up to best practices standards. So your personally owned devices, if they're forced to be on a guest network, there could be all sorts of limitations that are going to cause problems. Next, let's do a live poll. So we're going to throw a little question out there to the audience. And the question is, who is allowed to use personally owned devices at your organization? And you can see the options there. This was one of the questions from our survey, and we're just curious to understand from the audience on the call today who actually, what your responses are, and then we'll show what we retrieved from our survey. So just give you a couple more minutes and we'll close the poll. All right, I can see that a lot of people are allowing physicians and IT staff to, hold on one sec, I gotta extend this a little bit, too small. And administrators, IT staff, all very high, nurses quite a bit lower, and then additional staff sort of in the middle there. So it looks like, yeah, administrators and physicians and IT are really the most popular roles for using BYOD. You can see that, in each of these cases, those roles generally tend to be more on-call type roles where they're going to be needed 24/7. They often tend to be people that either are very influential in the organization or, are more technically savvy. So let's go ahead, now that we have your results, and move on to the next slide that is actually the same question. So the next thing you need to know about BYOD is its use by role. And what we saw in our survey is actually mirroring what you answered quite quite well. You can see that physicians are obviously the biggest users of BYOD, with 62% using BYOD. That actually seems to me to be quite low. I would expect more of a percentage of physicians using BYOD. Almost all the physicians I've worked with and the environments I've worked with have been mostly BYOD. You see 54% IT staff, 53% nurse practitioners, which that's a little surprising to me, but I think with the nurse practitioner role, sometimes we see shared devices, sometimes we do see them using their personal ones. Administrators at 49%, nurses 43%, housekeeping staff 31%, and transport staff 22%. Now you can see this is really mirroring some of the stats that we talked about earlier, right, where we see physicians do prefer to use personally owned devices. The demand is there, the use case is there, it really makes sense. With nurses, it's not as much. Now, I think we're going to see, and there's another webinar we have out there where our CNO at Spok, Tay Guyton, talks about this. I think we're going to see a rise in more BYOD in nursing, but it is going to take more, I think, of a change in culture and, you know, just changes in the trends before we see that. But you can see they mirror really sort of the use cases as well as the preference for personally owned devices. Let's throw up another live poll here. The question is, what areas does your BYOD policy cover? And you can see the various different options down there. You can select all that apply in this case. So if you want to go ahead and just, if you have a BYOD policy, just let us know which of these things you have in your policy. Security of devices, device support, what device brands and versions you support, policy enforcement, and who pays for what. So we'll go ahead and close the poll here in a moment, and we'll look at the results. All right, it looks like a good majority kind of include all of these things, with the highest being device security and which devices are supported, right? So these are very IT-oriented things that relate to the use of these personal devices. And then there's also enforcement policy for non-compliance is also really high out there. So those are the biggest ones. So this is also a survey question that we asked in the survey, and let's see what our 350 respondents said about this. So the next thing that you should know about BYOD is what our policies covered. We have 81% that said the security of devices is very aligned with what you all responded. 76% said that they cover which devices are supported, which again is very in line with what you all responded to. Enforcement for policy non-compliance is another high one. Which devices, brands, versions are supported, and then who pays for what is at 53%. All of these were kind of the highest. This is the top 5 things we found in our survey that are covered in BYOD policies. You know, from a Spok perspective, I would say the things that we include in our sample policies, which I'm about to show you all one of our sample policies here in a moment, but we include eligibility, expense allocations, user roles and responsibilities, security and feature management, IT involvement, penalties and sanctions, and an area for user agreement. Well, let me show you all actually an example of the policy that we provide to our customers as part of our consulting service. So if you're looking to build out the BYOD policy, we'll work with you and we'll give you best practices guides on how to build policies, how to build out education campaigns to push the policies out and inform your users of what they are and what they mean. And this is an example policy right here. So we include an overview in terms of who's eligible for BYOD. We include a scope and applicability, excuse me. We include information about supported BYOD models and which devices and operating systems are supported under the policy. We also include information about expense allocations, which include stipends and discounts through carriers. Things that relate to roles and responsibilities could be acceptable use of the device, the personally owned device, on-call policies, device maintenance, loss and theft, warranty and replacement, application downloads and upgrades, a section on transmission and storage of highly sensitive data. That could pertain to how you're using text messaging and phone call and different applications to share highly sensitive data, which would include PHI. Backup and file sharing, termination of employment. And a lot of times with some of these security-related things, there's an area in this policy where we actually outline the HIPAA requirements and align those with policy statements. So that really helps, I think, the user understand what's the point of this. Why are we actually doing this? It's for the patient. It's for protecting patient information and enforcing HIPAA. Security and feature management, you want to make sure that you're covering anything you're going to do with MDM or enterprise mobility management. Again, there could be another section here about transmission and storage of highly sensitive data. E-discovery, you want to make sure you're real clear on what you're actually going to discover from the device. This is oftentimes very, very, this is a sensitive topic, right, for the user, because if you're going to have a BYOD policy in place and you're going to do any kind of security and feature management, the user is going to be most concerned about, well, what can you see on my device? They're not as concerned about you enforcing security things on the device, perhaps like a passcode and things like that. Their biggest concern is going to be, what can you see? So you want to cover that really carefully. Outline what you can see and what you can't see, what you won't look at. Here's that HIPAA technical safeguards thing I just talked about. And then in terms of IT involvement, you want to outline what IT support for these personal devices will look like. Again, what IT has access to, and then have some statements about employee privacy. You can see this is really heavy on user roles and responsibilities, sort of the acceptable use of a personally owned device, how the IT group is going to secure it. And then there's a good bit of stuff in here about, the privacy for the employee, which is really an important part of the policy that needs to be outlined. So this is sort of an example of a policy. There's a lot of good meat in there that obviously I don't have time to cover, but just wanted to show you guys an example. We're going to lead into another live poll here. If you all will participate, be awesome. Our question here is, what are the main drivers for allowing or planning to allow a BYOD environment? So are you driven by wanting to save costs because you can't deploy devices to all your employees? Is it response to demand, from physicians, could even be from other roles such as nurses or frontline staff? Easier communication among care team members, or workflow time savings for users? So if you go ahead and respond to that, we'll close this poll in a moment. And our results say that actually the top reason is cost savings. So, we need these users to be able, these clinical users to be able to gain access to these really useful tools, but we can't afford to deploy devices to them. That's the top reason. It looks like easier care communication for care team members is number 2. In our survey of these 350 healthcare respondents, we see that actually easier communication was the top driver for BYOD this year. And it actually wasn't. Cost savings was last year. We can see that the respondents of this particular survey said, hey, easier communication among care team members is the most important reason why I want these users to be using their personal devices. And cost savings was number 2. Workflow time savings followed that. And then you can see response to demand. So the demand is actually, I think it's a lot of times, particularly with the physicians, it's been kind of fulfilled over time, right? That's going down further and further because there's so many physicians that are actually already on BYOD. But in terms of the big drivers, right, this is just a huge benefit statement, is it does enable better and easier communication among caregivers if they have a tool right in their hands where they can access all the information that they need and communicate back and forth with other caregivers, regardless of where they are, right? Whether they're in the hospital or outside of the hospital. So that's a really cool thing that's kind of gone to the top. And I think this is a really good segue, and the next thing you should know about BYOD is the average number of work-related applications, because this is really the driver of that benefit we just talked about in the last slide, right? It's these applications oftentimes are the things that enable easier communication. Physicians use 4.1 applications on average, work-related applications, and nurses use 3.2 work-related applications on their personal devices. This actually kind of surprises me. I thought there would be more, but there are so many useful applications out there, from enterprise apps like Spok Mobile for messaging and alerting and on-call. Airstrip is a great enterprise app that streams information from medical devices to show things like EKG readings, You got Epic, Haiku, and Cerner mobile apps that provide access to EHR information. Meditech is a great application that providers can use to get record information about test results, order prescriptions, schedule appointments, and stuff like that. I've seen a lot of physicians using Patient Keeper, which is basically a mobile application for CPOE, allowing to get lab result orders and radiology, medications, different things like that. And there's internal apps, right, that are really fueling a lot of productivity. Like the, I could use the example of the Mayo Clinic app. If you just Google like Mayo Clinic hospital or patient application, they got a really cool website that actually outlines all the things that patients can do with that app, and that's actually used by their caregivers as well, because they can send secure messages back and forth between patients, and the patients can request appointments, and it allows them to interact with the clinicians at Mayo. Also gives them like a daily update on advice to help be more proactively manage their health. Now, there's a ton of consumer apps out there too. I mean, Hippocrates, right, for drug information and looking up things regarding drug interactions. PEPID is a good solution I see in some emergency rooms where it's used for clinical decision support. UpToDate has become a more popular application. It allows clinicians to get answers to specific questions in the time that they need it. Then, of course, there's Doximity. It's been around for a while. That's sort of the social media network, if you will, for physicians. I see a lot of physicians using that to just look up caregivers at other hospitals and collaborate in the medical community. There's Medscape Mobile, which, of course, is the WebMD. We've got a mobile version for drug reference. There's a lot of caregivers are using a combination of these internal tools, these consumer tools, as well as these enterprise applications to really drive a lot of value. And not just that, but they're using just basic stuff like Evernote and email and things like that, which is also driving a lot of great productivity. And it's hard sometimes with some, internal, hospital deployments of devices to provide all this functionality. So if you're deploying, Wi-Fi devices or something like ASCOM, they're great devices. They provide a lot of value, like let's say for a nursing group, but then you don't have access in these cases to access this depth of all the applications that are out there and available. You see that the last thing you want to know about BYOD in 2017, then we'll open it up for a couple questions after I go through some key takeaways here, but the EHR mobile applications were rated 3.5 out of 5 for reliability. So this actually, this could be related to the fact that, maybe a user can't access the application to get the data that they need, or that the information in the EHR is not accurate. That there's not the data there that they're looking for. So there's perhaps a bit of interpretation in regard to what reliability means, but that's actually kind of surprising to me there. I would think that it would be a little bit higher in terms of accuracy. I think it perhaps relates to the data. So let's look at some key takeaways just to reiterate some things. 71% of hospitals now allow BYOD based on our survey, and that compares to 58% in 2016. That's huge growth year over year, right, in the adoption of BYOD. We're seeing that trend higher and higher year over year. A majority of physicians prefer to use their own mobile devices, while the majority of nurses still prefer to use hospital-issued devices. And we talked about some of the reasons why some nurses and frontline staff tend to prefer hospital-issued devices still today. For the first time, easier communication among care team members is cited as the top drivers for supporting BYOD. So, for example, if you want users to be able to access on-call, send secure text messages, receive alerts on their device anytime they need it, and have their work stuff separated from their personal stuff on their device, and have the ability to control message flow, status escalations, forwarding, different things like that, you got to put enterprise communication out on their device, right? And that's going to drive a lot of value. And that's actually, that kind of thing is why a lot of hospitals are really starting to allow BYOD, because they just need to get these really useful applications in the hands of their users. But you can't always afford to deploy devices to every single user in the organization, particularly if you were trying to support mobile data plans, right? That would be very, very expensive. And the top 3 challenges for BYOD is Wi-Fi coverage, data security, and cellular coverage. So things you need to be thinking about whether you support BYOD or not yet. Those things are all extremely important, and they're challenging. So that's all I have in terms of presentation content for today. I'm going to go ahead and open it up for questions. I do want to actually, I apologize, before I do, I wanted to cite the fact that all the survey information did come from a survey that we provided, again, to 350 healthcare respondents, and we actually have a full report on that online. It is in the handout section of GoToWebinar. If you want to just click on handout and click on the survey, it looks like this. You can also get it from our website on our resources page. Tons of really useful, valuable content here that really goes into a lot more depth, even on the things that I talked about today, and include a lot more survey results that were not even covered in this particular webinar. So check that out. Now I'll go ahead and take questions.
Awesome. Thank you so much, Jason, for that insightful presentation. We will take some time now to answer your questions. It looks like we've had a couple that were submitted already, which is great. If you do have a question, please submit it in the questions box, which is in your GoToWebinar toolbar, and then we'll answer as many as time allows. So Jason, our first question is, what responses from the survey surprised you the most this year?
You know, I think that I was a little surprised by the number of applications that are being used. I mentioned that during the presentation, actually. I thought there'd be even more clinical applications that are being used on average, but I think that maybe is skewed by a lot of caregivers that don't yet really haven't bought in fully into using their personal devices for clinical use. I think that I was actually surprised with the number, I think it's 63% of physicians that said, or hospitals said physicians were using their personally owned devices. I thought that'd be quite a bit higher. But I do see BYOD just really trending up, and the majority of the other results, I think, were really in line with my experiences.
Awesome, thank you. Another attendee has asked, from your experience, who should I get involved when I'm starting to define my BYOD policy?
That's a great question, and we actually have that as part, I think, of this year's survey. I know that we have it in some of the surveys we've run very recently, and we're actually seeing an increase in more clinical roles getting involved in developing BYOD policies. So, you know, IT is definitely a group that needs to be involved, IT leadership. You know, security, IT security would be an important resource in creating your policies. You're going to want to include HR, perhaps even legal, I think, for penalties and sanctions and different things of that nature. Telecom, you'd want them involved, the call center. Clinical leadership and specific clinical champions, I think it's really critical that doctors and nurses and clinical leadership are involved in the creation of BYOD policy. Because you want to make sure that it is covering all their needs and their concerns as well. And ultimately, a BYOD policy shouldn't just be about security and management and support. It should really kind of extend, ideally, into sort of the value that these personal devices are going to drive, and that's where the clinical group can really come in to help. And then the other thing is, you know, consultants can be helpful. Spok does have this as part of our consulting services practice. If you are interested in looking to build out a BYOD policy or a program, we can help you do that as well. So I see more and more hospitals leveraging consultants.
Excellent, thank you. Another attendee has asked, can you explain the MDM for non-IT folks?
MDM for non-IT folks. So I think a question is just, can I give more of a basic description of what MDM is? Is that fair?
Yep, I think so.
Okay, cool. So MDM, in this case, I'm referring to the acronym as Mobile Device Management. It's also more currently referred to as Enterprise Mobility Management. And examples of these tools are, you have AirWatch, Mobile Iron, there's Jamf Software's products. There's a lot out there that allow you to manage the device. And in the base level, mobile device management the tools allow you to deploy profiles to the client device, so to an iPhone or an Android. And when you deploy that profile, the server then has the ability to essentially talk to the device and send it commands and say, hey, I want to now, on this device, enforce a passcode, for example, and not allow the user to turn that off. I want to encrypt this device. I want to get inventory from this device. I want to understand what operating system it's running and what applications are running on it and different things like that. So the basic capabilities of this are they provide an inventory of the device, so specs and information and settings on the device. You can get visibility into those things. It can be used for management and security, so basically enforcement of specific restrictions and settings on the device. It can be used for deployment. So if it's a really big value add of mobile device management. So for example, let's say you wanted to deploy Spok Mobile, but you don't want users to have to download it from the App Store. What you can do is use a mobile device management tool once you've deployed MDM to the devices in your environment, and you can distribute Spok Mobile to all of the users of, let's say, a specific AD group, or all your users in your environment, or certain people with a certain role. You can auto-distribute that Spok Mobile application as a managed application. And if it's deployed as a managed application, you have some controls over it. You can also remove it when the user leaves the organization, for example. They're really great tools, and you think about it from the perspective of deployment, inventory, and security. I think those are really the cornerstones of mobile device management tools.
Excellent. Thank you so much. Looks like we are just about at time, but we've got another question here. Do you think that BYOD allowance will continue to rise?
Absolutely. I mean, Spok's been doing the survey for years now, and I think I could be misstating this, but I think we saw the biggest rise year over year this year. It is continuing to rise year over year. We're seeing more and more hospitals adopt BYOD programs, and if we go back to that earlier statistic, that 71% of hospitals this year say they allow BYOD, whereas only 58% said last year that they allowed it. I mean, that tells me, and the trends year over year we're seeing, it just tells me it's going to continue to rise. And if I look at the demand and the numbers that we talked about in terms of how many physicians and nurses prefer to use their devices, and even the ones that are using them when BYOD is not allowed, I mean, all those trends tell me we're going to see it continue to grow.
Excellent. Thank you. Unfortunately, we are out of time, so we will go ahead and conclude our webinar there for today. If we were unable to get to your question today, we will be sure to follow up with you offline. And if you'd like to chat with a Spok representative on the topics that we discussed today, you can do so using the link that's in your chat box. You can also continue the conversation with fellow attendees by using the hashtag SpokWebinar on Twitter. And follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spok, as well as industry news and trends. Thank you all again for joining us. We hope that you found this webinar informative and that you have a great rest of your day.